For crisis and trauma counseling, an excellent technique to use is called eye movement desensitization and reprocessing therapy, also known as EMDR. This is very useful for people that suffer from PTSD, and particularly the symptom of recurring and intrusive trauma memories. When people experience these trauma memories, particularly when they have developed PTSD, but not necessarily, many times they'll experience the somatic and sympathetic responses that they experienced during the traumatic event. And when the body responds this way outside of a distressing situation, it can become problematic. The way that this therapy works is it uses bilateral stimulation, usually through back and forth eye movement or back and forth taps one shoulder to the other. It can also be buzzers in both hands. It could be sounds. But the bilateral stimulation happens while the client remembers the memory. They focus on how they were feeling, how their body was feeling, and the brain is able to reprocess that memory in an appropriate way and also desensitize the client to those somatic and sympathetic responses. So the way that this would work is when you have a session with a client, you would begin by taking their history and having the client provide a particularly troubling memory. And you'd start by creating a safe, so to say. In their mind, they can create a container for the memory and all of the feelings associated with that memory. For safety, they can store all that inside their container for if we need to do another session, or if the session becomes too much, they can put everything away and we can continue from there. That container can look however they would like, but we can create that container and then we can move into actually reprocessing the memory. So we ask the client to recall that memory and to focus on how they were feeling, both emotionally, also physically in their body, what sensations are coming up. At the same time, we would ask the client to say do eye movement back and forth. So we'd have them watch our fingers back and forth while they are recalling their memory. While they're focusing on the bilateral stimulation, we can just reassure the client, tell them to just be aware of how you're feeling in your body and in your mind. And then after a short period of that, you can stop and you can then converse with your client, ask them how distressing were their feelings, what beliefs are attached to this event, and at some point you can have the client give you a new positive belief to attach to the event or themselves in place of a negative cognitive belief. Then from there you can ask them if they have a new memory that has come up, and you can see if the client is good with continuing from there, or you can put everything away in the container and wait until the next session. So that's a little bit how that works. This is, like I said, particularly useful for dealing with trauma memories, which are very prevalent in people that have experienced a traumatic event, particularly people that have developed PTSD because of traumatic events. And so many sources from the APA to the World Health Organization, they recognize from many studies that this therapy is very effective.